welcome to today's episode in our series on epilepsy, in our mini health series that we are doing. In today's topic, we're going to go over what are the risk factors involved in getting epilepsy. And with this, I'm going to go over what a risk factor is, and then what the different risk factors are in getting epilepsy. So let's begin. Now, a risk factor is something that makes a person more likely to develop seizures in epilepsy. Sometimes a risk factor can cause scarring of the brain or lead to areas of the brain not developing or working right. Now, the risk factors included in getting epilepsy are babies who are born with, they're born small for their age, like a preemie. If a baby is born prematurely and say they're only like 1 pound and they're tiny, that could be a risk factor to have seizures. Babies who have seizures in the first month of life. Babies who are with abnormal areas in the brain, bleeding in the brain, abnormal blood vessels in the brain, serious brain injury or lack of oxygen to the brain, brain tumors, infections of the brain such as abscesses, meningitis, or encephalitis, stroke resulting from blockage of arteries, cerebral palsy, conditions with intellectual and developmental disabilities, seizures occurring within days after head injury, which we call early post-traumatic seizures, family history of epilepsy, or fever-related seizures. Alzheimer's disease, which is late in the illness, not on the onset of Alzheimer's, but in the more advanced stages of it. Autism spectrum disorder, fever-related, otherwise known as febrile seizures that are unusually long. Long episodes of seizures or repeated seizures called status epilepticus. Use of illegal drugs such as cocaine. Mild head injuries such as concussion with just a very brief loss of consciousness. They don't normally cause epilepsy, but yet the effects are repeated mild head injuries, and epilepsy is unknown. So generally, if you have, like, you bang your head maybe once, there's no proof that that's going to cause a seizure. But then on the other hand, if it's a repeated process, it's more and more damage to that area, and that may, I'm not saying it will, but they're saying it may cause seizures. It's not quite known. I mean, it's hard to do a study on that. You can't just say, okay, we need to do a study on head injuries and continually give somebody a head injury to do it. It doesn't make sense. Okay, what if I don't have any risk factors, you say? Well, although the disorders and injuries on the list help explain many causes of epilepsy, more people with epilepsy don't have any of the risk factors. Often we just don't know how or why epilepsy gets started. So you see, you may not have any of the things that I just mentioned for risk factors, but you still may get epilepsy. you have to understand a lot of mental disorders, we don't know what causes them. There's no way of telling. You could get pregnant and say, oh, well, I need to get tested to make sure my baby's not going to have any mental disorder. There's no test they can do for that. Okay? A lot of them, there's just no way of knowing. Well, what are seizure triggers then? Well, let's go over what some seizure triggers may be. Even though you may not know the cause of your epilepsy, you can look at whether there are factors, often called triggers, that replicate or provoke seizures. These triggers may make a person with epilepsy more likely to have a seizure in certain situations. The triggers could change the number of severity of seizures. Learning if you have any triggers can help you learn what to do next. Okay, so if you do have a seizure, you can learn what some of your triggers are that bring them on, so you may be able to change that, or so you'll know what to do when a trigger happens and you prevent further injuries. So let's go over what some of the triggers are then. Mismedication, lack of sleep or disrupted sleep, illness, both with or without fever, psychological stress, having alcohol use or seizures after alcohol withdrawal. Those are better known as DTs. Use of cocaine and other recreational drugs such as ecstasy. Over-the-counter drugs, prescriptions, medications, or supplements that decrease the effectiveness of seizure medications. So like you could have another issue where you have to take a different medication and it may counteract your seizure medication, and that's what they're talking about. That's why it's always good that if you have any medical issues, you be upfront with your doctor, you tell them what you're taking for medications, so they can make sure they don't give you another medication to counteracts that. Okay. Nutritional deficiencies, vitamins and minerals, like if lack of certain vitamins and minerals. Excuse me. Poor eating habits such as long times without eating, dehydration or not enough fluids. For females, the menstrual cycle or hormonal changes, flashing lights or patterns, specific activity, noises, or foods. Now, not everybody's going to experience all of these. They may experience one, two, or none. But most people do experience the triggers, and if you know somebody with epilepsy, you can ask them. That's the best thing to do, is be informed. Don't judge them. Try to help them out. You know them, and if you want to help them out, say, look, I know you have seizures. What are some of your triggers, so I know that I can help you out better when you're with me? So I know what to do if you have a seizure. I know, I can, if I see these coming, I can ask you, are you okay? And those are the most important things, and these are what we need to do to help people. So as you can see on this side of my screen, on the left side, some of the risk factors that they mention here. Now, like I said, I went through a whole list. They just narrowed it down to genetics, brain damage, brain infections, and alcohol use disorder, okay? So those are just some of the common things that we go over. Excuse me for a minute. It's always good to know what causes a seizure, what triggers it. The more informed we are, the more we can help others that we love, whether it be family or friends. That's why it's good to have the knowledge on all these, okay? Now, I do apologize for these being a long series, but some of these are more detailed and there's a lot more involved in them, and that's why they're longer. And I don't want to just cut it down short so you don't have all the information. The more information you have, the better you can help others with it. Now, before I let you go, I want to leave you with these words that I always tell you because they do mean a lot. And when we do this, we're a much better person and it's a better world. Remember to always see with your heart and not your eyes. Because when you see with your eyes, all you see is the outside. You don't know what's going on in that person's life. You haven't walked a mile in their shoes. But when you see with your heart, you see inward, outward. You know what that person's like on the inside, and that's what matters. That's why, like on my page, I have what I have for a banner. That's why my motto is to see with your heart and not your eyes. Because I've been there. I've learned how to see with my heart at a young age, and I've also been one of them people that's been judged wrongly because people judge by what they see. It's okay, let me give you an example. Most people, when they hear somebody saying legally blind, their mind erases that word legally, okay? And they just prejudge and say, you're not blind, you can see. There's a difference between being blind and legally blind. Okay, they see me for the outside, so to them, I'm not blind. They're not my eye doctor. They don't know what I do. They don't know what I go through. Because they're seeing with their eyes. Now, if they were seeing me with their heart, they would understand the difference between being legally blind and being totally blind. There's a difference. Yes, I can see. I have more sight than a totally blind person. And even totally blind people misjudge them. Totally blind, there is no actual such thing as totally blindness. And to give you an example, if you have the light on and you close your eyes and then move your hand in front of your face, you can see the shadow of your hand. You can't see nothing but that the darkness covering the light. That's what total blindness is, okay? They can't see shapes or anything, they just see, it's dark to them, but yet if something goes through that darkness, they can see that part, okay? But that's not what this is about. I just wanted to give you an example of seeing from the eyes and seeing from the heart. So remember to always see from your heart and not your eyes. Don't judge somebody unless you can walk a mile in their shoes. If you know them inside and out, which none of us do, we're all made uniquely different. We don't know what each person's life is, and sitting there saying something bad about somebody could be the straw that breaks the camel's back. So always remember to uplift instead of bringing down. Your words of encouragement or inspiration or love could be what saves a person's life. And it's much better to save a person's life than to say something that could cause them to kill themselves. You hear about it every day. Kids that get bullied, people picking on them constantly. They're going to break after a while. So you don't know if that one time that you said something that wasn't nice, if that was going to be their breaking point. You have no way of knowing because you are not that person. You have not gone through what they're gone through. You don't know what they go through on a daily basis. That's why it is so important to see with the heart and not the eyes. Because when you see from the heart, you only want to encourage, uplift, and inspire. You don't cut anybody down. You look at it and say, I don't know what they've been through. I don't know what they're going through. I don't know what they're suffering from. So I'm not going to be the one to say that comment that could cause them to take their life. Okay? Always remember, guys, see from the heart, not the eyes. And until tomorrow when I do my live stream at 3 o'clock, remember, I love you, you're uniquely made, and you matter to me. Have a great day and be blessed.